Hi, this is just a quick provider video to go over some steps in Athena that are a common issue that we see on the unit. Starting with care instructions underneath your diagnosis. If a care instruction is not auto-populated, please search for an instruction, open it. Please be sure that it's a Healthwise care note. Select Discuss with Patient, and that will be available for us to print during discharge. Another thing that we're commonly seeing is that please be sure that your medications that you want us to administer are in administer status and not prescribed. Otherwise, the staff is unable to task this off. For DMEs and injuries, please make sure again that your ACE wrap is in dispense status, not prescribed. Your splints are also in dispense. Also with an ACE wrap, please type in your SIG, apply to left ankle under air cast, and then in your air splint, you would type in apply on left ankle over ACE wrap. That way there's no confusion on what the staff should be doing. If you want the staff to construct a Orthoglass splint, this is the order you should be using. Application of Orthoglass splint. Open it up and change it to no alarm. You can leave the size blank because we'll measure the patient, but you do need to include the type of splint you want. If yours is not listed there, this list seems to be short, please just type it in View More and Note to Provider, but include the location of where you want the splint applied and what side you want it on. And then the staff will open up the correct procedure documentation that we need for billing. But this is the order that should be used. For cultures, we're seeing a lot of cultures that aren't switched to no alarm and then View More. You have to change it to Office. So people are forgetting to open up this View More tab and changing it to Office Collection. If this doesn't get changed, we can't task it off, and it ultimately affects our lab because they get a order for an external lab. Even if we delete this, the incorrect order still remains within our lab system. So that's that. Hospital admit and emergency department visits. These are the correct orders to be using. You'll open them up and hit View More, and you can just type in Note to Provider, Hospital Admit St. John, Maine, any pertinent information that we need. Same with emergency department visit. You'll hit View More and type in where you sent them, and just so that we know when we look back at the chart. Another section that we're going to go over is patient instructions. Here's where you add your follow-up instructions. And to do that, you type in a period and UC, and you'll find all of our templates. But we're finding that a lot of charting is missing follow-up dates. So follow up with your PCP in 5 to 7 days. It's a template on there. Unfortunately, I can't show you them because I don't have provider access. But if you hit period UC, you'll see all of our templates. The discussion notes section is anything you discuss with the patient that you want charted. Please note that both of these sections do appear on the patient's discharge instructions and the charting that goes to the primary care. If you want something to remain private in our chart only, the appropriate spot to chart it is in the physical exam. Another reminder is just to make sure that anything you order is documented in Athena, oxygen therapy, any meds you want administered, any orders you want need to be in Athena for complete documentation so that we can bill for everything. And then just make sure that this discussion notes section and patient instructions are clear so that when we glance back at charts, we know the whole story. If you order a lab and it was unsuccessful, say you ordered a culture and we were unable to obtain it, you can go into the View More actions and add internal notes. Sometimes we're looking at charting and we're not able to tell what exactly happened with the patient because the charting isn't complete. Let me see what else I have here. Last thing here is that when you're done with the patient's A&P, You're going to hit sign off. Click this, oh, it's this one over here, and done. You're going to hit ready for checkout. If you don't do this, the staff is unable to discharge the patient easily. You will then go on to doing your HPI, ROS, and PE, but please make sure that you're done with your A&P prior to putting the chart up in the discharge rack. Even if you chart fast, we're finding issues that we're printing discharge instructions prior to you finishing your charting, so the patients are going home with incomplete discharge instructions. So again, just finish this section. You go into the sign off tab under the done section and hit ready for checkout. And then you can go back and finish the rest of your charting after the patient, or however you like to do it at the end of the shift. I think that's all I have for you guys. The other thing I'm adding to the bulletin board is how to add order delegations. Again, it doesn't show up under my list because I'm not a provider, but you're going to select the gear. You'll have an order delegations section, and I'm going to have a piece of paper posted on the bulletin board that shows you exactly what delegate rights you want to give each person. That's all. Thank you. I do just want to clarify that the physical exam portion does not print for the patient, but all aspects of the chart do go to the patient's primary care physician. So it does not say internal, but these 3 sections do not print for the patient.